Trevor Gibbens Unit takes great care and pride in its services for women. We understand the concerns that can come in such circumstances, and we try to alleviate this for each individual as much as possible. For females, we offer a range of considerations and options to help in recovery and general living. This video looks more into them.
So, thinking about the philosophy of female care at the Trevor Gibbens Unit, one of our main aims is to try and provide a really safe and validating environment for the women to live in, because we recognise that perhaps they've not experienced that before in their lives, and so coming to the TGU is perhaps the safest place they've ever had to live.
The care the female patients receive is consistent, safe and supportive. Obviously we are a medium secure unit and there are some secure boundaries connected with that. But apart from that, I feel we are actually a very open service. We really try to give patients as much liberty as we possibly can.
So thinking about how treatment work differs for female patients compared to male patients, and thinking about it from a psychological point of view specifically, we run the same sort of treatment programs for men and for women, but when we're thinking about the women, we tend just to have a female-only group so that they don't have to be sat in a room talking about their really difficult past experiences, perhaps with a group of men that perhaps in the past they felt quite persecuted by men. So to put them into the same group wouldn't be ideal. But then at the same time, some women would prefer to work with men, so in which case there's the option for them to be in a mixed treatment programme.
A lot of our patients have suffered extreme sort of abuse from an early age. So we're working with some quite traumatised individuals. This obviously can come out in other ways. So we do see sort of quite a lot of emotional behaviours. And a lot of our work is dealing with kind of emotional problems. So really kind of, I think sort of being a supportive environment is really, really important.
And we work as a really close-knit multidisciplinary team. So we've got the nursing team, we've got the psychology team, the social workers, the medics and occupational therapy, and we all work really closely together. And to help with that and to help our team's understanding of the individual patient and their individual needs, we'll often meet on a regular basis for group supervision, and that's usually led by the psychology team, but what it allows everybody to do is to come together and think about the experience of that patient, think about how we can help them on a day-to-day basis on the ward.
It's about getting all of our staff on board, really understanding the nature of that patient. It can be a challenge, but it certainly does work. The more you understand an individual, the better the prognosis.
So what we try and do on the women's service is take a gender responsive approach. So we'll think about the different needs that women have compared to men. So if you think women have obviously got quite difficult relationships in the past, they may have experienced severe trauma in their pasts, they'll present with a high level of perhaps self-harm, they'll have children that we need to sort of maintain a relationship with. So it's thinking about all those individual needs and thinking about how we can do our best to help the patient meet all those needs and meet the goals that they want to meet.
We have to kind of like work with that patient to work through these problems. So it really is taking a psychological approach to our work. The thing that we really focus on is actually making the environment supportive and making it somewhere where patients feel safe. And I think that's where hope can come from.
So we're often thinking about recovery as the main philosophy of the ward and trying to instill hope into the patients that come to us. They've often had really difficult backgrounds, and so hope and recovery can be a really difficult thing for them to sort of think about moving towards, particularly if they've come from a place where they've been really struggling. So when they come to us, it's all very person-centred. We think about what are the goals that they want to achieve, what is it that they want to get out of moving forward. So we think about how particularly we can help that individual. So it might be that they've got specific interests that perhaps we can encourage them to pursue. It might be a particular activity, but it's about thinking about the person as an individual and thinking about their individual needs and what we can do to help them with that.
I mean, we really try to put the patient in control of their care.
If you require any further information regarding our services for women, please do not hesitate to get into contact with the Trevor Gibbens Unit on 01622 723 100.